Hello, this is Dr. Grande. Today's question is, what is the relationship between shame and cluster C personality disorders? So this would be avoidant, dependent, and obsessive-compulsive personality disorders. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about this concept of shame and the cluster C personality disorders, I'm going to be using a study here that was published in 2010 by Schoenleber and colleague, which really addresses this very issue, looking at a few aspects of shame and looking at the cluster C personality disorders. So let's start with shame. So shame is a perception that an individual has that they have some sort of defect in themselves. And this perception is a distressing emotion. Theoretically, this emotion leads to withdrawing, fleeing, attempting to escape. And this is different than guilt because the behavior that comes from guilt is trying to make amends. So in comparing shame and guilt, we usually think of shame as more problematic, particularly in the mental health treatment community when we deal with both shame and guilt. Usually shame is a bit more concerning. There are different ways to think about shame when we think about treating individuals who have mental health symptoms or mental disorders. One way of thinking about it is the idea of shame-proneness. And this is the propensity to experience shame across a number of different situations. So this would be how likely somebody would be to experience shame in multiple situations. Now, shame-proneness has been studied and has been associated with a number of different mental disorders and symptoms of mental disorders, including anxiety, depression, posttraumatic stress disorder, hostility, aggression, eating disorders, and a fear of intimacy. Another construct here around shame would be shame-aversion. And this is when somebody sees shame, when they perceive shame as being particularly undesirable, unwanted, or painful. Now, we know from just the definition of shame that these are distressing emotions. But with shame aversion, if somebody has a high level of shame aversion, they find it particularly distressing. So they may really work diligently to avoid situations where they will feel shame. Now, with this particular research study that I'm talking about, they really wanted to see if shame aversion was related to shame-proneness. They wanted to look at that interaction. And they believed that lower levels of shame aversion may lessen the effects of shame-proneness. So really what they're suggesting is that shame-proneness is only important when there are high levels of shame aversion. So an interesting theory and a couple different ways to look at the concept of shame. Now we talk about the cluster C personality disorders. We're talking about the anxious, fearful cluster. And there are three personality disorders here: avoidant, dependent, and obsessive-compulsive personality disorder. We know that, of course, OCPD is different than OCD. So the personality disorder, obsessive-compulsive personality disorder, is a different construct than OCD. Now, the cluster C personality disorders have been specifically linked to this concept of shame, and each personality disorder is linked in a bit of a different way. So with avoidant personality disorder, we believe these feelings of inadequacy lead to shame. So here somebody would avoid social situations, avoid social interactions in order to avoid shame. Now, with dependent personality disorder, we believe that a sense of competence and autonomy do not develop, probably because of some of the aspects seen with parenting. Like if parents are overprotective or over-nurturing, that could be problematic. That's just one factor, of course, that contributes to dependent personality disorder, and really just one factor that contributes to this sense of competence being compromised. So when this sense of competence and autonomy don't develop, there's this idea that individuals with this disorder depend on others to avoid exposing that incompetence. Now, interestingly, obsessive-compulsive personality disorder really has the same result, which is this idea that somebody's trying to avoid exposing an incompetent version of themselves. But the reason before that, the reason that avoiding behavior occurs, is a bit different. With OCPD, we look at it more like somebody's trying to achieve the ideal self. So they work diligently to achieve the ideal self, and that helps them to avoid exposing the incompetent self. So what were the results from the study? What can we learn about shame and the cluster C personality disorders? Well, we see here with this study that high levels of cluster C personality disorder traits were associated with higher shame-proneness and higher shame-aversion. This study also showed that high level of dependent personality disorder traits were very strongly associated with an automatic association between shame and pain. Another interesting finding here is the difference between shame-proneness and shame-aversion. It would be easy to believe that really these concepts measure the same construct, but it turns out they don't. As expected with this study, shame-proneness has more importance in the presence of high shame-aversion. So there's a relationship between these two concepts, and again, they're not measuring the same thing. I believe another important element in terms of the results of the study really has to do with how difficult it is to study cluster C personality disorders. We see in this study that only 35 individuals here, in terms of the participants that were sampled, met at least sub-threshold levels for at least one cluster C personality disorder, and only 18 met the full criteria for at least one cluster C personality disorder. So it is difficult to find adequate sample sizes of individuals who have cluster C personality disorders. And I think it's difficult for a variety of reasons. With avoidant personality disorder, obviously somebody with this disorder would be more likely to avoid social interactions, so participating in a research study would not be something that you would picture that they would be attracted to normally. We know that for dependent personality disorder, there's a real focus on that supportive relationship, that individual that the person with dependent personality disorder is dependent on. So again, that is a distraction and probably not a lot of motivation to enter into a research study. And then with obsessive-compulsive personality disorder, what we see oftentimes with individuals who have this disorder is that they're working. They tend to work a number of hours and they tend to be quite productive. And this, we believe, comes from this orientation toward details and this appreciation of organization, schedules, lists. So somebody here is focused on perfectionism and again, work productivity. So we see it would be unlikely that somebody with this disorder would want to take time out from work to participate in a research study. So individuals with cluster C personality disorders are a difficult group to get a hold of for different studies. So it's difficult for us to conduct these studies and to learn more about the characteristics of these personality disorders. Another thing that happens here with studying cluster C personality disorders is a lot of these studies end up studying the traits, so levels of personality traits related to these personality disorders, rather than studying individuals who actually have the personality disorder. Now, this isn't an uncommon practice. This isn't just limited to cluster C personality disorders. But of course, normally, when studying a disorder, we would rather study an individual with the actual disorder as opposed to an individual who simply has traits of that disorder. So this study on shame and cluster C personality disorders is interesting because of what they found regarding shame and shame-proneness and shame-aversion, but also because of the nature of studying individuals who have cluster C personality disorders. I hope you found this description of shame and cluster C personality disorders to be interesting. Thanks for watching.